Greetings from Suraj Eye Institute, Nagpur. Surgical management of Ectopia lentis. Ectopia lentis is defined as an acquired or hereditary lens displaced from its natural position because of defects in zonular filament. It may occur as an ocular manifestation of a hereditary systemic disorder like Marfan syndrome, homocystinuria, Weil-Marchesini syndrome, hyperlysinemia, and sulfide oxidase deficiency. It may also occur without any systemic abnormalities such as idiopathic ectopia lentis. It commonly induces a large refractive error, a partially phakic or aphakic visual axis, and or anisometropia. In young children, these visual disturbances, if left untreated, can induce dense amblyopia. A female, 10 years of age, came with complaint of difficulty in reading since past 5 years. Her unaided visual acuity was 636 in the right eye and counting finger at 3 meter in left eye. She was not accepting any correction. Anterior segment examination showed iridodonesis in both eyes. Equator of the lens was visible at the edge of the pupil, showing superotemporal subluxation of clear crystalline lens in both eyes. Fundus examination was normal. Axial length was 22.5 mm in right eye and 23.03 mm in left eye. Anterior segment slit lamp photograph of the right eye and left eye showed superotemporal subluxation of clear crystalline lens. After detailed systemic and ophthalmic examination, a diagnosis of ectopia lentis not associated with any systemic condition was made. She had a subluxation of 7 clock hours in both eyes. We planned a single stage procedure: lens aspiration, capsular segment insertion, capsular tension ring insertion, PCIOL for her. She underwent the same first for the right eye and then for the left eye. 6 weeks post-operatively, she had improved to 6/12 in right eye with a correction of -0.5 diopter sphere and +1.75 diopter cylinder, and 6/9 in left eye with a correction of +0.5 diopter cylinder. Post-operative slit lamp photograph of right eye and left eye showing an in-the-back posterior chamber intraocular lens and capsular segment. Examination of the mother showed similar subluxation in both eyes. She had never been examined earlier. Ectopia lentis can lead to diplopia, strabismus, and impaired vision which warrants early intervention. Spectacle or contact lens may be offered for patient, but this may be associated with relatively high possibility of developing amblyopia. Long-term complications include zonular weakness and lens instability, which is complicated by the loss of capsular bag, vitreous disturbance, and endothelial cell damage. Surgical advances have improved patient outcome in recent years with the inclusion of various techniques including pars plana vitrectomy with lensectomy, sulcus fixation of intraocular lens, iris suture intraocular lens, iris claw intraocular lens, scleral sutured capsular tension ring with intraocular lens placement, sutureless sulcus intraocular lens placement, and anterior chamber intraocular lens placement. Subluxated lens extraction in these patients is challenging, and complications include intraocular hemorrhage, intraocular lens dislocation, transient rise of intraocular pressure, endophthalmitis, and retinal detachment. Post-operative residual refractive error can be corrected with glasses or contact lens. In our case, in-the-back placement of intraocular lens caused minimal vitreous disturbance, which may help in reducing the chances of future retinal complications. Thank you.